suppose what our research kind of highlighted really was that children and young people, that there's such a large gap really between the time that children and young people first experience the first signs of poor mental health and the point that they get the help that they need. I mean, it's a frighteningly long period of time. We wouldn't accept it if it was a physical health difficulty. There's a sort of 10-year gap really between the first signs of poor mental health and a child getting effective help. And most of that gap, some of it is taken up is the result of embarrassment and stigma, but the large proportion of that kind of treatment gap, that delay, is accounted for by the fact that children don't know what's happening to them, young people don't know what's happening to them, neither do their parents sometimes. It's a confusing experience. And it takes a long time to realise that there's a need to go and get help. I think one of the other sort of big difficulties is that most parents with a child with diagnosable difficulties, we know, seek help. They go to professionals. They tend to go to mostly to schools, but sometimes to their GP. But still, only a quarter of children and young people get effective help. And I think that's something that we need to look very closely at to try and